After 40, many changes inside the body become quieter but more important. You may not feel them directly. You may not notice pain. But beneath the surface, your cardiovascular system begins to shift. Your heart has been beating nonstop since before you were born. By the time you turn 40, it has already beaten over 1.5 billion times. That constant work leaves subtle wear. Arteries slowly lose elasticity. Blood vessels become slightly stiffer. Recovery from stress takes longer. None of this happens overnight. It is gradual. One of the first changes is arterial flexibility. In youth, arteries expand easily with each heartbeat. This flexibility helps regulate blood pressure smoothly. After 40, collagen structure changes and small amounts of plaque may begin accumulating. Even in healthy individuals, arteries naturally stiffen with age. This means the heart must push slightly harder to circulate blood. You may not feel this, but your body compensates. Resting blood pressure can slowly rise. Morning readings may be higher than they were in your 30s. This is not necessarily disease. It is adaptation. But adaptation has limits. Stress plays a bigger role after 40. Cortisol regulation becomes less resilient. Chronic stress causes blood vessels to constrict more frequently. Over time, this creates persistent tension inside the vascular system. The heart responds by increasing force. Elevated blood pressure is often less about age itself and more about unprocessed stress patterns accumulated over decades. Sleep also influences cardiovascular health more strongly after midlife. Deep sleep supports blood vessel repair. Poor sleep increases inflammation markers. Many adults after 40 experience lighter sleep, more nighttime awakenings, or shorter total sleep duration. Even small sleep disruptions can influence heart rhythm stability and blood pressure regulation. Metabolic health directly impacts heart function. Insulin sensitivity decreases with age. Blood sugar fluctuations become more common. Elevated glucose damages blood vessel lining over time. This damage is microscopic but cumulative. It affects the smooth interior surface of arteries, making them more prone to plaque development. Inflammation is another silent factor. Chronic low-grade inflammation increases after midlife due to diet patterns, stress exposure, environmental toxins, and sedentary behavior. Inflammation accelerates arterial stiffening and contributes to cardiovascular risk. Physical activity patterns often decline after 40. Work becomes more sedentary. Recovery feels slower. Many adults unintentionally reduce movement, yet the heart thrives on moderate, consistent motion. Walking, light resistance training, and zone 2 cardio strengthen heart muscle efficiency. Without movement, cardiac output gradually declines. Hydration also matters more than most people realize. Dehydration thickens blood slightly, increasing workload on the heart. Many midlife adults consume more caffeine and less water, which can subtly strain cardiovascular function. Hormonal shifts influence heart health too. In men, testosterone gradually declines. In women, estrogen drops significantly during perimenopause and menopause. Estrogen protects blood vessels by supporting elasticity. When levels decline, vascular stiffness can increase. This partially explains why women's cardiovascular risk rises sharply after menopause. But here is the key. Sensitivity is not fragility. The heart becomes more responsive, not weaker. It responds more strongly to lifestyle inputs, good and bad. This means changes you make after 40 have powerful impact. The heart after 40 demands consistency, not extremes, not crash diets, not sudden intense workouts. It responds best to steady, moderate, predictable patterns. Understanding that cardiovascular aging is gradual and modifiable changes everything. Protecting your heart after 40 is less about dramatic transformation and more about daily architecture. First, stabilize blood pressure naturally. Walking 30 minutes a day lowers resting pressure significantly over time, not intense running, not high-impact intervals. Steady walking improves endothelial function, the lining of blood vessels. It enhances nitric oxide production, which helps arteries relax. Second, prioritize sleep depth. Protecting 1 extra hour of quality sleep improves heart rate variability, a key marker of cardiovascular resilience. Avoid late heavy meals. Limit late-night screen exposure. Keep bedroom temperature slightly cool. These small habits improve vascular repair during sleep cycles. Third, reduce chronic inflammation. Increase omega-3 intake from fatty fish. Add leafy greens daily. Replace processed seed oils with olive oil. Reduce ultra-processed carbohydrates. These dietary shifts directly influence arterial flexibility. Fourth, manage stress deliberately. Stress does not disappear after 40, but stress response can be trained. Breathing exercises, slow nasal breathing, and regular quiet time lower sympathetic nervous system overactivation. When stress hormones decrease, vascular tension decreases. Fifth, maintain muscle mass. Resistance training improves glucose regulation and reduces metabolic strain on the heart. Muscle acts as a glucose reservoir, stabilizing blood sugar. 2 to 3 strength sessions per week significantly improve cardiovascular markers. 6. Maintain social connection. Isolation increases cardiovascular risk. Emotional support buffers stress hormone spikes. Meaningful conversation lowers blood pressure. The heart is not only mechanical, it is responsive to emotional states. 7th, monitor numbers calmly. Blood pressure, resting heart rate, fasting glucose lipid profile. These are not threats. They are feedback signals. Early awareness prevents escalation. Another overlooked factor is breathing pattern. Many midlife adults breathe shallowly under chronic stress. Shallow breathing keeps the nervous system slightly activated. Slow diaphragmatic breathing improves vagal tone and heart rhythm stability. Consistency compounds. The heart adapts to patterns. If daily life becomes calmer, more rhythmic, and moderately active, the heart remodels positively. Importantly, cardiovascular protection after 40 does not require fear. Fear elevates stress hormones. Awareness and structured action are more effective than anxiety. The heart after 40 is a responsive system. It listens carefully to your habits. It reflects your rhythms. If you design daily life around moderate movement, restorative sleep, anti-inflammatory nutrition, emotional regulation, and stable routines, the heart remains strong for decades. Aging does not mean inevitable decline. It means increased sensitivity to how you live.